Ladies and gentlemen, esteemed colleagues, I am Morkos, the Minister of Health, and it's my esteemed privilege to discuss with you today the critical topic of our response to the COVID-19 pandemic. The COVID-19 pandemic stemmed from the novel coronavirus SARS-CoV-2 and surfaced in late 2019 and has since posed multifaceted challenges globally. As of February 11th, 2024, the cumulative numbers stand at approximately 774 million confirmed cases and 7 million deaths, illustrating the gravity of its impact across societal, economical, and health dimensions. Central to our discussion is the role of the Ministry of Health in navigating public health crises such as this COVID-19, from formulating evidence-based policies to orchestrating emergency responses and healthcare provisions. Our ministry stands as a cornerstone in safeguarding the health and well-being of our population. As stewards of public health, the Ministry of Health is tasked with multifarious responsibilities. Our role extends from policy formulation to operational implementation, covering diverse facets of pandemic management. The first one is policy development. The ministry, at its helm, is devising comprehensive strategies encompassing testing protocols, quarantine measures, vaccination strategies, and overarching public health interventions. These policies are underpinned by rigorous scientific evidence and expert consensus. Second one is resource allocation, ensuring adequate access to essential resources, including medical supplies, personnel, and financial allocations, forms a pivotal aspect of our responsibilities. Resource distribution is guided by epidemiological trends and demographic needs. And lastly, our ministry endeavors to disseminate timely, accurate information to the public through various channels. Transparency, clarity, and accessibility characterize our communication approach, aimed at fostering trust and adherence to public health guidelines. The ministry's response to COVID-19 pandemic has been multifaceted, characterized by concentrated efforts across several fronts. Robust testing infrastructure coupled with contact tracing endeavors have been instrumental in identifying and isolating cases, thereby curbing transmission chains. Transient quarantine measures have been implemented to mitigate transmission risks, ensuring the isolation of infected individuals until they are no longer contagious. Extensive public health campaigns have been rolled out to raise awareness and promote preventive measures, such as hand hygiene, mask wearing, and social distancing. Close collaboration with healthcare providers has facilitated the dissemination of best practices, provision of adequate resources, and cohesive patient management strategies. Meaningful engagement with communities has fostered a sense of collective responsibility and compliance with public health measures. And I want to emphasize the fact that the community engagement is the center of our attention. We will battle this COVID pandemic with the community engagement and all hands on deck. Vigilant monitoring and surveillance efforts have enabled early detection of outbreaks, informed policy decisions, and facilitated targeting interventions. The ministry remains agile in its response, continually adapting strategies based on evolving epidemiological data and scientific insights. Resource management lies at the heart of our pandemic response, ensuring the optimal allocation and utilization of essential assets. Many people throughout the globe are suffering from this point, specifically resource management. So we have this in the back of our mind as the ministry and Ministry of Health and addressing these issues. First, the distribution of critical medical supplies, including personal protective equipments, PPEs, and pharmaceuticals, are coordinated to meet demand. Efforts are directed towards healthcare infrastructure, including the provision of adequate hospital beds and establishment of temporary facilities to accommodate patient surges. Workforce mobilization and capacity building initiatives are prioritized to bolster healthcare delivery capabilities and alleviate staffing shortages. However, we also understand the importance of communication and having communication strategy. So clear, transparent communication is paramount in fostering public trust and facilitating informed decision making. And we will make sure we do that by having timely information. So having regular updates on COVID-19 developments are disseminated throughout diverse communication channels, including official websites, press releases, and social media platforms. We also understand the importance of having accuracy assurance. Information accuracy is very important, with data sourced from scientific sources and subject matter experts. Last but not least, combating misinformation, which is very critical in our stage. Being vigilant and having vigilant efforts are undertaken to debunk misinformation and combat the spread of rumors, thereby having a safeguard public health discourse. Also, promoting trust and having transparency and accountability. And we do this by having a decision-making process and acknowledge the uncertainties. Also, as I mentioned earlier, having community engagement, having two-way communication engagement between the ministry and the public, and listening to concerns and provide clear explanations to questions that come up from the public perspective. Also having empowering individuals, and this is critical, and developing tools and resources for informed decision-making to take ownership of their health and well-being for the public. Effective pandemic responses necessitates seamless collaboration and coordination across multiple stakeholders. Having government agencies and healthcare providers and international organizations and the private sectors, all they come together. Interagencies collaboration ensures a unified response framework with resources and expertise pooled for maximum impact. Partnerships with healthcare providers facilitate coordinated patient care, resource allocation, and capacity management efforts. Engagement with international bodies facilitates knowledge exchange, resource mobilization, and alignment with global best practices. Private and public partnerships drive innovation, resource support, and collaborative initiatives such as vaccine development and distribution. And also coordinating and having information sharing and having a task force and committees that all come together and communicate about the COVID pandemic, and having regular meetings and updates so we can also inform the public. You may ask what challenges we are facing as a minister and what lessons have we learned. So the pandemic has presented multiple challenges alongside invaluable lessons. Overcoming logistic challenges in resource procurement, distribution, and management has been a persistent hurdle. Also, resource constraints, like I mentioned earlier, having shortage of supplies has been affecting all countries. Shortage of medical equipment, shortage of personnel, and financial allocations have necessitated adaptive resource management strategies. Also, evolving scientific understanding of the virus itself, the dynamic nature of the pandemic, demands agility in response to evolving scientific insights and epidemiological trends. What have we learned so far? We learned being preparedness and response, having robust preparedness plans, flexibility in response strategies to address dynamic situations. Also, we learned communication and transparency, having a clear and transparent communication. Timely and accurate information dissemination is very important when we deal with the public. Collaboration and coordination with stakeholders and sharing information and coordination efforts. What future outlook do we have about the virus? Looking ahead, our focus remains on continued vigilance, preparedness, and adaptation. Having to control the COVID-19 spread, ongoing efforts encompasses vaccination drives, testing initiatives, and public health measures aimed at curbing transmission and preventing the spread of the virus. Also, having a future plan for preparedness, being strategic planning and investment in research, infrastructure, and response capabilities underpin our preparedness in our future health emergencies. Last but not least, importance of continued vigilance. Sustained vigilance against emerging infectious threats underscores the imperative of adaptive response strategies and cross-sectional collaboration. In conclusion, our collective response to the COVID-19 pandemic optimized resilience, collaboration, and unwavering commitment in public health. We extend our gratitude to all stakeholders for their steadfast support and engagement throughout this journey. Moving forward, let's remain united in our resolve to safeguard the health and well-being of our communities today and the days to come. Thank you.